Good morning.
I hope you all are fine.
Hey, good morning.
Yeah, so we should be starting our meeting in 1 minute.
Good morning.
Hawajaanza. Kama wanapiga story.
So, good morning, everyone. So, I think I will kick off the webinar. I can see here, I don't know what happened. You can do camera. I also saw Achieng and Achieng, and I think we're waiting for Ango. Rose, kindly confirm if you're in the meeting so that we can start the meeting. Can you mute your microphone so that we can be able to listen to each other well, clearly? So once again, good morning, everyone. So as we all know, kindly whoever hasn't muted their microphone, kindly mute your microphone so that we can hear each other clearly. Okay, asante sana. So let's kick off the meeting. So as we all know, we are marking the Global Week for Action on NCDs, which is an event that is marked yearly in effort to control the, in effort to advocate for, rather in effort to advocate for control of the rising numbers of NCDs globally. And so as we all know, NCDs are basically diseases that can actually be controlled and are caused by a number of risk factors, of course, which includes tobacco, smoking, which includes alcohol use, unhealthy diet, and lack of exercise, rather, and fitness. And we all know that, according to data, in the next decade, at least 90 million deaths will occur because of NCDs. But I feel like NCDs are one of those issues that haven't been really taken seriously in the society for one reason or another. And that is why it's important as NCD, people who work in the NCD area, we should speak up always and raise up these issues to enable the policy makers and other stakeholders actually realize that we're actually putting the future generation at risk if we don't take steps. And so this year's theme, of course, is on accountability. And in this case, by accountability, we mean that we hold our policymakers accountable, the government, and even stakeholders that take part in tobacco control and the industry itself, both, alcohol and tobacco industry, since we are going to focus on those two industries specifically for this particular webinar. So I want to welcome everyone once again. And with us, we have our panelists. Of course, one from KETCA, our chairman, Mr. Joel Vitali, who is yet to join the meeting. We have Kiriba in place of Mr. Philip Gishana. Then we have Mr. Gideon Ayodo from NCDAC, and we have Mr. Ishmael from Blue Cross Kisumu. So I want to welcome all our panelists today. And with that said, I want to welcome them to also introduce themselves. So we can start with Mr. Ishmael from Blue Cross. Kindly introduce yourself, what you do, and just a brief remark.
Good morning, everyone. My name is Ishmael Shem. I work with Blue Cross here in Kisumu. Blue Cross basically exists to support families that are affected by alcohol use and harm. We do prevention. We do mostly public education on issues, substance abuse, majoring on alcohol within Kisumu and its environment. So that's Nyanza and Western Kenya.
Okay, thank you, Mr. Ishmael. You are welcome. Next is Mr. Gideon Ayodo from NCDAC.
Yeah, good morning, everyone. My name is Gideon Ayodo. As has been said, I work with Non-Communicable Disease Alliance of Kenya. Non-Communicable Disease Alliance of Kenya is an umbrella body of organizations that are working in areas of prevention and control of NCDs in Kenya. So we are comprised of a number of organizations that are working in a range of NCDs prevention, including cardiovascular, cancer. Others are working on chronic diabetes, and amongst others. So that's just a brief introduction of NCDAC.
Okay, thank you, Mr. Ayodo. Kiriba, kindly go ahead and introduce yourself.
Good morning, everyone. The secretary to the board of ACPN, also a human rights advocate and board representative for the East African Regional Policy Alliance. Our mandate is generally to foster policy, pro-public health policy and legislative interventions. Thank you.
Okay, thank you so much, Kiriba. Just to mention that this webinar was organized by KETCA, which is the umbrella body for tobacco control in Kenya. Then we have also ACPN. We have National Taxpayers Association, where I work. We also work on issues on tobacco control in Kenya. And also we have the Institute of Legislative Affairs, who also work on tobacco control. So welcome all again. I think we just kick in and start right away. And I'll start with NCD Alliance. We know you are an umbrella body that actually works with organizations that work on matters NCDs. And just to start this conversation, maybe you can give us a brief description of what NCDs are. What are the causes of NCDs? What are the specific numbers, or rather people who have been affected with NCDs in Kenya? And what is the impact, even in terms of socioeconomic development in Kenya? Kindly, Mr. Ayodo, go ahead.
Yeah, so I'll start with the first aspect, asking what NCDs are. So non-communicable diseases are those diseases that cannot be transmitted from one person to the other person through maybe social contact or through, they are basically those diseases that cannot be transmitted. So these diseases include, some of them that I already mentioned, include cardiovascular diseases, include diabetes, also include heart conditions, also include sickle cell, amongst others. Yeah, so those are kind of diseases that we are referring, or conditions that we are referring as non-communicable diseases. Yeah, so Ideally, our work as NCD Alliance of Kenya is to coordinate a number of organizations that are working on specific issues or specific disease conditions. And there are some of them, for example, KETCA is more on issues of tobacco control. We also have other organization like DMI, which is dealing with the issues of diabetes. We also have other organizations that are focusing on issues of heart conditions, and amongst others. So, so our role as Alliance is to coordinate these organizations and also to be able to build, provide capacity building for these organizations to be effective in terms of the implementation and also in terms of influencing the policy. And we also work closely with the Ministry of Health during this particular time, especially in the COVID period. We've worked also with, through our, we have a caucus of persons living with NCDs that are brought together to discuss issues. And during this particular time, we had challenges in terms of access to healthcare, in terms of access to basic commodities that are required for prevention or control of NCDs. So they had a platform where they were able to discuss and they are able to present some of these challenges to the ministry and some of the policymakers for the follow-up. Yeah, so I think basically that's some of the things that we were able to do, and we've been able to do this during this particular period. But I would say a number of issues that are affecting persons living with NCDs, or that comes with the NCD condition. We are aware that these are conditions that are long life and therefore require long-term medication, or require also management, long-term management, and therefore they are kind of also expensive to manage, and also expensive to manage in terms of care, and also expensive to manage in terms of treatment. So then we've been experiencing the people who are affected in one way or the other has been experiencing a challenge. But also we are also aware that the health care system has also not been prepared enough in terms of managing NCDs. We are aware that some of these conditions, for example, the lung conditions and others, are always they are not diagnosed at the right time, and therefore these conditions are discovered when it is quite late in their stages, and that makes also the treatment to be expensive. Yeah, so those are some of the challenges that are being faced by persons living with NCDs, or that are being faced by people who are taking care of persons living with NCDs. Yeah.
Thank you, Ayodo. I think we have picked very key issues, among them being they're expensive to treat. The government is not prepared enough, especially the Ministry of Health. And some of these things we're just going to pack them, and we are going to discuss them in maybe the next round that you're going to speak. So having said that, we'll move to Blue Cross, Mr. Ishmael. Kindly just tell us more about drug and substance abuse, the effect, what challenges have you been going through, even as you do your work in regards to NCD control in Kenya?
Thank you so much, Marion. Working with in the field of majorly alcohol or substances of abuse is really challenging. And this basically does not call for only one party. What I mean is most of the people that are affected, those are the ones who are probably the users, the abusers, the addicted ones. The society has looked at them as the ones who are in trouble, the ones who are in problem, the ones who are sick. But you see, if you have an alcoholic in a family, even one, if let's say the son in a family or the daughter, the mother, the father, the other siblings are also suffering together. Majorly, you will find that the whole family is the one that is sick, and not the addict. The addict would be very happy because they are high, they don't know, they don't care, they don't work, they don't provide, they don't do anything. But the kind of havoc that is raised within that family or the community because of just one person affected by the drugs of abuse is greater than if we had the whole family sober. So we find in our work that we have to in our prevention work we incorporated the whole family, because you realize that the support system for an addict basically comes from the healthy people around them. So the ones who are healthy are the ones who are basically called on to support the one who is, because we say alcoholism or drug use is a disease. And today, even as we mark this global week of NCDs, we're talking about disease. Disease, I have always looked at it as two parts, the D's and the E's part. So you are not at ease. So basically, using drugs does not make you at ease. So that's why even as Ioda has explained in NCD as they do. So we develop programs at Blue Cross, one for prevention, but the main call for us is to call everyone to a lifestyle of abstinence. So if there would be either, if it is possible, practice total abstinence, which is, most people say it's very hard, but for sobriety, you really need to work towards that. We advocate for abstinence, that it could help you. If you have not touched alcohol, if you have not started drinking, please stay away from it. And that's what our most campaign is working on with the youth, the children, the families, because we work with families mostly affected with alcohols within the villages, the slums, and the peri-urbans of Nyanza and Western Kenya. The other thing that we're really asking for, which has been a campaign for mostly, I think this was developed by NACADA and with the alcohol industry, those who are fighting against that, we would campaign for supply suppression with demand reduction. So this means basically that if the supply is cut off, then the demand would be lower. Because if there is, people mostly demand for it because it is available. But also you find that it is because of this that the people or the industry or the ones who are dealing with these substances have found out that they really must make the demand high so that the supply can be brought in. And I think the last thing that we are really campaigning also is for the policies to be enforced. There are good policies that has been put in place, basically for tobacco control and for alcohol control. It has been even devolved even to the county levels. And we ask every time in our campaigns that the counties that are the ones who are custodians of the policies, that they would be the ones to really enforce. But most of the times you find this is the opposite, that the ones who are supposed to enforce the policies are the ones who are always probably, if not the first ones to flout it. And so for our campaigns, basically the challenges that we have are those, the supply and the enforcement of the available policies. So we really have been working together with the county government and with NACADA and with our partners, especially within the country. And the ACPN has been really of help for us to make this message available to the community and to the county and for enforcement. And also we find that the media, much as they know, within the policies that the advertisement for alcoholic drinks would not come at a certain time of the day, they still would want, because of maybe kulipa bill, they have to make the advertisements come on odd times, or that are privy to what the children or the youth, when everyone is still able to watch, and you know the way the advertisements are really enticing. So we really are still within the campaign that we would all go for prevention. because basically your health would be your greatest help. Thank you,
Thank you so much, Mr. Ishmael. That is so informative. And just speaking from what you've told us, first of all, you clearly see that NCDs is not a burden of one person, but it's a burden of the society at large, because now the people who then the caregivers of that person have to go and work double to provide for them, and in case they get sick, they have to step in for them. You see that lifestyle issues have to be checked. We've also talked about policy. I mean, we've talked about quite a lot, but speaking about policies and enforcement, I also agree that there's been I think some weak enforcement. Yes, we have really nice legislation that govern the tobacco control and alcohol control in Kenya, but enforcement has been a bit of a challenge. And let me just pause at that and leave that for the next session, as we will be discussing about matters of policy, the challenges, what can we do as stakeholders, what have we done so far and what needs to be done better. So having said that, I want to welcome Kiriba from ACPN to just tell us more about alcohol. We know alcohol is a risk factor of majorly cancer and liver cirrhosis, and also causes disability. And it has even other effects like, exposing someone to things like diseases like HIV and AIDS. And so, Kiriba, would you kindly tell us more about alcohol control in Kenya? What have been the challenges? What is the impact specifically in health and even the socio-economic development? Asante. Go ahead.
Thank you very much, Marion. Maybe just to reiterate what my colleagues have said, and it's good for the figures to be out there as we note that the contributory factor to the NCD disease burden of alcohol, as well as around 6% of all global deaths, can be attributed to alcohol consumption and use, and its contribution to harm to health from an NCD perspective, as well as injury-related issues. And when talking about alcohol impact on economic development, we have to address ourselves to the value and impact of public health as a causative and contributory factor to, and definitely we do not have any other pillars as far as the economic growth is concerned. We find that there are so many arguments that are propounded about, from an industry perspective, that alcohol consumption is also a contributory factor to economic growth. And this is one of the myths that we need to demystify by actually addressing ourselves to the reality of the cost implication of treatment, prevention, and actually curing and rehabilitation of persons who have been affected by the consumption of these products. And the reality of things is that the bigger burden in this country as at now is the actualization of UHC, and you'll find that the contributor the public health sector are and the question of treatment has not been really addressed so far, mostly because government will propound the argument of inadequacy of resources, yet there's inadequate control. Actually, what is causing these resources to be, the need for these resources to be utilized, which are these substances contributing to the disease burden. So without actually contradicting ourselves, the reality is these products are causing greater harm than good as far as consumption, distribution, and marketing is concerned. And the resources that will be spent in treatment are actually more than what we can actually raise and marshal from the industry. And we have noted that there's been a lot of arguments around this industry is creating jobs, but then again, we have employees who are paid so much yet spend outrageously more on public health. And the question is then, how do we address ourselves to the question of the economic development? One, we need to work on the question of tax and price control. We need to raise more resources to address ourselves to the financial public health gaps that are arising from these products. And this can only be achieved and will also affect what my colleague Shem mentioned about reduction of access and prevention of initiation, which can only be done through enhancement of the tax and for the public health sphere. And we also want to look at it from addressing the question of what is the cost of the industry operation vis-a-vis the cost of government expenditure on alcohol, on NCD treatment and alcohol-related deaths. And if one outweighs the other, then clearly we must make a very clear policy intervention to make sure that we have addressed ourselves to bridging this gap in the public health sector. I'm sure we're going to address more issues of industry interference and the contributory factor to the NCD space. But for now, I beg to stop there, Madam. Thank you.
Okay, thank you so much, Kiriba. Just key highlights of what you've mentioned, of course, that the economic contribution of the alcohol industries and tobacco industry beat the logic of the cost of treatment of diseases caused by their products, number one. And number two, it also creates a huge health burden to citizens, specifically taxpayers. And even the jobs they create are not really impactful to the people because they end up also themselves being alcoholics, and the treatment or rather withdrawing from such addictions becomes a problem. And also we see that Kenya has committed to things like UHC, other treaties like the WHO, FCTC, SDGs. Also, we see that all these affect actually the achievement of these commitments. So the chair for KETCA is not here. However, we'll just go on with our conversation, and I'll be back to Mr. Ayodo, NCD Alliance, and I just want you to tell us, as far as policy, implementation of legislation with regards to tobacco and alcohol control, what is your take? Do you think enough has been done? The commitments that the Kenyan government has entered into, for example, the SDGs, the WHO, FCTC. We even have right now the ITP to control illicit tobacco trade. So, do you think the government is doing enough to actually actually implement these legislations and actually reduce the rising number of NCDs? What should be done more with regards to reducing the number of NCDs? Mr. Ayodo, kindly.
Okay, thank you much, Marion. Once again, I want to stress a point, then I move to your point that tobacco use and alcohol use leads to a number of NCDs that are interrelated. Cardiovascular diseases, cancer, chronic lung diseases, and diabetes. These are all caused by alcohol, and like it was said by one of my colleagues, is that when one is affected in the family, the whole family is affected. Therefore, we should be able to understand it from that particular point. In terms of policy, I would say that Kenya has developed a number of policies, and around NCD prevention and control. That also links to tobacco and also alcohol use. But one of the things that is a challenge is the implementation of these policies. Right now, we are just reviewing NCD prevention and control policy by Minister of Health because it is ending this year. But in terms of the implementation, I really do not think that it was really fully implemented, because then we would have seen a lot of enforcement. But we will also know that there are also some of the things that we've really fought for. For example, the Tobacco Alcohol, the Tobacco Control Act, and then also the development of the Solatium Fund that was supposed to have been established to be able to compensate for the harm that is caused. This has not happened up to today, and therefore the people who are affected are still bearing the burden. We are also aware that there are other policies. You've also talked about the UHC, which is supposed to cover give cover to certain of these conditions that we are experiencing, or the persons living with the NCDs are experiencing. This though the pilot was done, but then we are also aware that this is already experiencing challenges. But then we are getting assurance that maybe it will be implemented in a different format, or maybe it will work in the next few months to come. But we are all aware that we are experiencing challenges. One of the things that we need to know, that Constitution of Kenya guarantees everyone fundamental access to health. The Bill of Rights, Chapter 4, guarantees us that we need to have proper health care, and that is the starting point. And therefore, we believe that all other policies that are developed should also be able to and also consistent, and should have, we are able to implement all the policies, whether it's Tobacco Control Act, needs to be implemented fully, so that people are not do not face the harm of the use of tobacco and alcohol. But also, we are also aware that we are guided by other international or the global framework. For example, the Sustainable Development Goal 3, which also has indicators that also support in prevention of NCDs. Whether that has really been fully implemented really is also a question to ask ourselves, because then we also need to do a scorecard and find out. But in my own perspective, as a representative of Alliance Kenya, I know that we are focusing towards the advancements of the Sustainable Development 3, but then we also need to ask ourselves, because then this has not been fully implemented at the national level, because it's some of the things that we committed to. Yeah, we are also aware that we have the Kenya Health Policy, 2014-2030. One of the pillars of the Kenya Health Policy says its purpose to halt and reverse the rising burden of non-communicable diseases. And this, I think, really, if you look at the burden of non-communicable diseases right now, over 50% of the beds are occupied by patients of non-communicable diseases. We are also seeing rising deaths that are related to non-communicable diseases. With the COVID that just came recently, we are aware that the people who are most affected were those who had one or conditions of non-communicable diseases. And therefore, that is just enough indication that we have not fully implemented these policies to be able to provide safe, or to be able to provide a ground for us to say that the policies that prevent non-communicable diseases have been implemented. Yeah, thank you.
Thank you so much, Mr. Ayodo, for that. So I also want to welcome Mr. Gitali. Welcome to the conversation. We're just, yes, karibu sana. So I'll just move to the next speaker, who is Mr. Ishmael. So you mentioned a couple of things while you are doing, while you are giving us a brief about substance abuse and alcohol and tobacco. And so one of the things you mentioned was supply suppression to reduce the demand, which this obviously is increased taxes so that we can be able to reduce the demand. Do you think increasing the taxes actually work? And what is the progress of the government? Or do you think the government is doing its best to actually increase the excise tax to the maximum? For example, for tobacco, it's supposed to be a threshold of at least 70% retail selling price. I'm not sure about alcohol, but what do you think government is doing to actually achieve that, number one? Number two, in terms even of implementation at the county level. For example, when we look at tobacco, we have like no point of single stick sale is not supposed to be done. We are seeing issues of smoking zones. Do you think the government is actually doing its best to ensure that these things are put in place in reference to the existing legislation and even the global guidelines like the WHO FCTC? Mr. Ishmael, kindly unmute your microphone.
Sorry, Marian. Sorry, everyone. I believe, thank you so much for the question. I believe that the government is really working hard to make sure that its citizens are safe and enjoy quality health. According to the global goals, especially number 4 for quality health. But a lot is still in need to be done. Because just having policies or just passing the bills in the parliament and making them available is a good thing. But if it is not carried out or it is not enforced, or the public that the bill is going to affect or the policies are going to affect do not have the education or the wherewithal that they can access this information, then it's a process in futility. I would want to say that sometimes the policies are made in partial fulfillment of all righteousness. But if it is followed through, I believe all these efforts are good because the policies are passed. So we have a policy. The enforcement team is there. So we have people who are supposed to carry follow through, that the policies are there too. And then there is also the department, or I would want to say the wing of the government, let's call it NACADA, which is there to make sure that these policies within the counties are also available to the county and to hold them accountable, that it is followed through. And then the licenses, all that is in the policy. The licenses says that probably if you require a license of operation, of trade, then you need to involve the community that you're going to trade within. So public participation is called for. But you find that most of these things are partially followed through, because let's say who is the one who is selling alcohol within the community? It is my father, that's his business, or is my brother. So they are the people that we know. So if I'm the one in charge of licensing and they come to me and they want a license to operate a business, then I will consider all other factors. So if public participation is not carried out properly, like the due process is not done, then having the policy does not make sense. That's what I'm saying. So involve like all the way. Go all the way. Like let's say the legislation, they pass the policy, they put it on the right hand of people who are supposed to disseminate, because we have asked people within our communities if they have ever gotten hold of a policy that says anything about alcohol. And we realized that almost 80% of the people that we asked said they don't know. But if you ask them if they know that opening hours for bars or closing hours or sell to underage or proximity, all those, they say we have heard, but we don't know what it means. So you find that education is very important, even to accompany the policies that are available. So if we have a policy, make it available to the public, that the public are also aware of it, and not just having it, read it to them, or just have an education forum for us in the CSOs. We ask that most of the times when we go out, can the copies be availed to us? But you find that the copies, sometimes even finding them within the county is not easy. So you find that we also just have to download our own and use it to educate. And so we ask that much as the government is doing this, they put everything possible for the populace to be safe. Like you have mentioned, the smoking zones within the places. But you find you can still, like most places, you won't find. In Kisumu, we only have it at the airport. That's where you will see the smoking area. But within the streets, you would still find once in a while you will meet someone with a smoke. And it's in a public place, and it's no, they don't care whether it is affecting the next person who is now the partial smoker, whichever way. And you find there is no one who is even, if I raised my voice to a smoker next to me and say, can you switch, just zima cigara, it will be like, does it concern you, that kind of thing, which authority and that kind of thing. So I think that the enforcement still comes into play. And you find that when we talk about enforcement, then there is the limited personnel to carry it out. So you find Probably today, NACADA is working together with this institution to do a raid in a certain area. So it's that area that is going to be cautious because the raid is coming to us. And you find when the raid shifts to the other side is like imewashwa. And so you find there is that the public is not careful on the information that they have, that they are able to say that these people are not just raiding this place because they don't want us to smoke or to drink, but they care for our health. I mean, if the public are aware about their own safety, then it is up to the public to carry it out. I mean, to do the enforcement. And that's where supply suppression demand reduction comes in. And if there is no, I mean, because we say that there is a certain number of bus that is required in a certain community, and then you find, like for us, we have our main offices in Kibos, and Kibos has a market. And that market, before it was demolished, we had counted, we had outlets closer to almost 36. And you find, if you compare that to just shops that you can reach to buy grocery or sugar or anything that is consumable, you'll find that it is more than the number of shops that you can reach. So it makes it very easy, even for young people, to just access alcohol without, I mean, care of asking how old are you, who has sent you, for what are you buying, or for who. So it's really a challenge, even as the government puts every measures, but it still weighs down on the people themselves to really take care of this. Because just as I said, that alcohol, tobacco, every drug is not, when it hurts, it doesn't only hurt the user, but it grows back into the family. Thank you, Mariam.
Thank you so much, Mr. Ishmael, and I want to agree with you totally, especially on the fact that most people, rather the public, is not even aware of some of these policies. Giving an example, a practical one, I think I've gone to the shop several times, and I come across a shopkeeper actually selling single-stick cigarettes, and I ask them, hey, do you know this is against the law? No. Then I tell him, you should sell a packet. No. He tells you, if someone can't afford a packet, what am I supposed to do? That clearly shows that this person does not even understand what the law is, and even what the law says, and even what will happen if at all he's put in custody because of selling single-stick cigarettes. So again, I agree that there's a lot that needs to be done in terms of making the community understand some of these laws. For example, even smoking in public. Some people are still not aware that smoking in public is illegal. People just smoke in public like it's normal, not knowing that are actually affecting other people's, health. And I'll really agree on that. A lot needs to be done. Of course, it goes back to enforcement. We need to actually do a lot of enforcement. But then also speaking of enforcement, I'll move to Mr. Joel Vitali, specifically on now tobacco control. Maybe you can tell us the background of tobacco control, what has been happening in Kenya, where are we in terms of our commitments in the global framework and even our legislation, and even issues to do with enforcement, because we've had also issues of, underfunding, rather inadequate funding of the Tobacco Control Board and the Tobacco Control, unit, which has actually hindered their effective implementation, even down to the grassroots level. So maybe you can just cover these things, and even also as you do that, you can give us the challenges that have been faced in tobacco control in Kenya, including industry interference and how it has affected the work of tobacco control in Kenya. So sure, Mr. Gitali, go ahead.
Thank you, Marion. Somehow, although the line is not very clear, but I hope I'll be able to communicate. Indeed, I've heard a bit of what has been said. I was a bit late. I was held up at the studio, but I thank God I've found you going on. Now, Kenya has been ranked very highly for a long time in matters health and especially tobacco control, having been the first country in Africa to sign and ratify the WHO FCTC on the same day, So we have been ranked very high even in the present time, after doing well in matters legislation, taxation, and even implementation to some degree, compared to our neighbors and other countries in the region. And these gains might not really continue, or we might not enjoy this position because the gains we have made are sort of being lost. Recently, if you remember, when the consumer network released its research or information about whatever it was doing, because they talk about consumer information updates, we saw Kenya had gone back. We had lost some points, something that's not good. And things like when you hear the government listing tobacco as an essential product during this COVID-19 time, such things don't go down well with us, especially when other countries like South Africa, India, and the rest are actually banning tobacco or suspending it for some time. And here we are busy allowing. So the country is not positioning itself well. And the situation is getting worse even with the coming of the oral nicotine products like Lift, which is now flooding the market. Something that is bad because it has been licensed by the Pharmacy and Poisons Board. And this is an organ of the Ministry of Health. And the Ministry of Health is the one talking about the effects of tobacco. And Lift on its packet is written clearly that this product is highly addictive. And then you look at it and ask yourself, that is this what we are supposed to be doing? Is this the direction we must be taking? So we need this kind of product regulated. It must be removed from the market and only sold if it is indeed, as the government talks about it, as an aid to quitting smoking. Then it is supposed to be found on the pharmacies and given on prescription, doctor's prescription. It is not supposed to be sold everywhere, even in petrol stations. You wonder what kind of vehicles are going to be powered by this kind of product. So it must be something that we should all be concerned with, given that we are told that nicotine really affects the brains of young people. When young people are growing up and then they take in nicotine products, then their development is interfered with. And therefore, the government sort of by licensing Lift or tobacco products is sort of deliberately and irresponsibly trying to poison the young people's brains so as to have many mental cases in the country, something that we must be fighting off. So we should understand that tobacco industry interference is real, and because such a kind of a thing cannot take place unless the industry has compromised those in charge, unless the industry has made itself so appealing to the government. Recently, BAT thanked the government for making it to remain afloat during this COVID-19 time when others were going down. So you see, instead of farmers who are supposed to be helped by the government to switch to alternative viable economic alternatives, there it is the industry thanking the government for helping it to continue killing Kenyans. So it's a bad thing that we must all condemn, and we advocate for regulation of these products that are so bad. And just to touch on this area of implementation of the laws that we have. The laws that we have, the Tobacco Control Act of 2007, the Tobacco Control Regulations of 2014, and then the Shisha ban of 2018, and other related laws are not being implemented by this government that we have. An example is the Tobacco Control Fund that is supposed to be in place so as to receive the solitium compensatory contribution from tobacco companies. It is not there yet from 2007. And yet, even the Supreme Court gave clearance to the ministry to collect this money from the tobacco companies. But then there is that dilly-dallying. That is a clear way of saying that somebody somewhere has been compromised. This is a form of tobacco industry interference. It is laxity on the side of the government and irresponsible kind of behavior. Because the Tobacco Control Board talks of not having funds. We hear the Tobacco Control Division talking about the same. The NCD department of the Ministry of talks about not having resources. And yet, resources that are supposed to be coming in are not coming in because a fund has not been put in place. Who will you talk about as the culprit here? Unless we talk about our government and tell the government to walk the talk. You talk about tobacco as having adverse effects on the people and on the environment. Let us see you walk the talk that you are putting in place measures that are going to ensure that this doesn't happen, that taxes are going high, where education is reaching the people, and that regulations are in place, and all these things are being done in the right manner. So that is one thing that we must ask the government to do, to put in place the Tobacco Control Fund immediately. The other thing that we must also ask the government to do is to deregister these oral nicotine products from the pharmacy and the poisons register, where they think they have put this as something that is useful, so that these things are handled the way they are supposed to be handled. And then we must also ensure that people are getting information, that during budgetary allocations, we have resources put aside so that we can have the Tobacco Control Board, the Tobacco Control Division, and even other stakeholders being funded so as to educate the people. And just as something that I should also mention here, much as we talk about those smoking zones or the designated smoking areas, they are in our laws, yes. But you see, there are specifications how they are supposed to be built. And that's why we are saying we don't want to see these things that are hazardous to our lives, like in the city of Nairobi, those that we term as designated smoking areas. They are very dangerous, and we are asking the government to remove them. They should not be where they are, because they make those places very filthy. And those in the buildings around those areas are actually smokers. They smoke every day. When people go to those things to smoke, they pollute the entire area. They are not built according to the specifications of the World Health Organization, FCTC. So even when we talk about Kisumu not having, you know, if they put them up, they'll put them up the way they have done in Nairobi, and they'll still be polluting those areas. So we must take care of our health. We must move forward, because tobacco is a bad thing that is causing all types of ailments. We are talking about cancer being the leading. We have diabetes. We have cardiac problems. We have all the kind of things that you can think about. And if all of us can ask the government to tell us why a product that kills 9,000 Kenyans every year has become an essential product. The government should tell us how a product that compromises the respiratory system has become an essential product during the time we are fighting corona, which also attacks the respiratory system. The government should tell us why this product that interferes with the entire immune system has become essential at such a time. So let us rise up and ask the government questions, so that at this time we need tobacco fully suspended from our markets. We don't want things to do with the tobacco. Like now we have another form of interference whereby tobacco industries donate some funds to the government to fight COVID-19. This is wrong. On one hand, the government is not putting in place the tobacco control fund to receive funds from tobacco industry. On the other hand, it is receiving donations illegally from the same. This is something that must not be happening in Kenya. That is a form of tobacco industry interference, giving money to the government for such a cause, so that we are talking about sponsorship, something that is not supposed to be there. The cooperative social responsibility is not supposed to involve tobacco industry. It's a form of interference. And this being given license to sell dangerous goods, and this thing of being assisted to remain afloat, all these things we are talking about are pointing at something wrong. And in the country where tobacco industry, especially BAT, has been accused of having bribed some people in the past, policymakers, high-ranking officials in the government, we can easily suspect that there are people here who are being given money by these companies so as to look the other side. As we are talking now, we have the plan of action that is supposed to be running from 2019 to 2023. Let us ask ourselves, can the ministry say with confidence that this part has been implemented, this part has been implemented, we are implementing this, coming up with plans of actions that just expire, then we come out with the new ones, and they are always funded, wasting taxpayers' money and donor funds, and yet we make them, put them on the shelves and wait for the next. This is something that we must avoid, we must stop, and we must call for full implementation of tobacco control policies. We must implement our plans, we must do what is right, we must walk the talk. Thank you.
Thank you so much, Chair. That was very insightful. So I can see we are left with about 5 minutes, but there's something I want to point out that I've just read in the comments from Philip Nyakudi Kishana, is the issue of online advertisement that has become very huge, both for alcohol and cigarettes. And even as Chair has mentioned, we have the new tobacco products, the leaves, the e-cigarettes, the snacks that are actually basically sold online most of the time. And in as much as the e-cigarettes and the other products are taxed, I feel like they are not regulated in terms of marketing. And probably we should strengthen our policies to ensure that some of these things are actually captured. And so even as we give our closing remarks, I want just each one of us to give a recommendation on what's the way forward, what can be done as tobacco and alcohol control advocates. And as you give your remarks, kindly also just touch on the issue of online marketing, your feel about it, and your suggestions on what we can do as tobacco control advocates, because it's actually becoming an issue. The industries have become clever and they're having their way out easy through online marketing. So I'll start with Mr. Ishmael. Kindly give your closing remarks and just give your thoughts on online marketing and the new products and how we can control them. Thank you.
Thank you so much for that. I believe that everything during this COVID time has gone online, and just has been alluded to by Joel, is that the government has put in place all measures to make sure that there is continuity for everyone, and the sale, everything, but all sale moved online. And we know very well that online registration has been flouted by many, starting by if I'm registering and I know I'm going to deal on dubious deals, then I don't use my real name. So there is no way you're going to track and say it was really Ishmael who did this. And we know those who hack, and we know youth, because they don't have ID, and online registration needs an ID. We have seen many children having accounts online, and so they are the ones who probably has been able to even increase in in the purchases of alcoholic drinks, of tobacco, whichever way, because now it has been made easier. You can hide your face on every area of the media. And the deliveries, because once you order online, it is delivered at your doorstep. No one is going to control how or who received or how you're going to use the amount of intake, which is in the policies, like how much you can drink, how much you can party with whatever you have ordered online. So we would still want to ask the government, because they have the machineries to always track on every system that is working within the country, that the available departments would be able to actually just make sure to find that if an industry is selling issues of drugs, substances of abuse online, then it has to be regulated how. And how do we police that? And so accountability, that's number one for me, that we must hold the government accountable of every details that they give, like Gishana has actually alluded to in his post, that and Amjoel also said, you can't allow this to be an essential commodity when it is killing, like he said, 9,000 people a year. And if it's also because we know under influence of any substances, you cannot control. Your immunity will go down. You don't have your judgment, mental ability is also compromised. And so you cannot really tell whether you will be able to control on any health issues. And we know these are triggers, because I know the triggers, number one is a trigger. Number two, then it is an enabler. And number three, this is not any ordinary commodity. So we cannot treat alcohol, tobacco as any other ordinary commodity that can only be purchased anyhow, anywhere, anytime, and consumed anyhow, anywhere, anytime. Because we know that under influence of any of these substances of abuse, most people say, I've been raised by alcohol. This is what educated me. But if you check the long term, because every substance has its effect on the long term. So either it will be on the long term on our economy, on the long term on your health, on the long term on your development. So if we really love our country, then basically we have to teach people to basically learn to say no. I mean, that is everyone now. The ones who see, because we see the youth within the community drinking, and I would go home and say, hey, mtoto anania yameharibika, and I can't do anything about it, and I can't even stop that person who was selling to them. I can't talk to the people just to sensitize them on the dangers that they're putting the community to harm. And so teach people, I mean, educate people to say no. I mean, you are doing a wrong thing, you're my brother, but you are wrong. And I mean, just say, alcohol is not a good thing. You are smoking here, you are harming us. No. I mean, you have to leave, or you have to switch, zima sigara. That's the only thing we have to teach people, because people have learned to not say no, but go and talk behind others. Because I see and I know it is my responsibility to, condemn and act, but then because I want to respect people's space, so then I will not say anything. So I don't even say, no, you can't smoke here. No, you can't drink now. No, you can't sell to underage. No, you can't have a bar here. So we have to teach the community to be responsible, even as the government is doing its part. So that way we are able to save our community, that we can take care of our health, because there is nothing healthy about drinking. There is nothing healthy about alcohol smoking. Thank you so much.
Mr. Ishmael.
Okay, two things here. One, it is now evident that the NCD burden is higher than before ever. And it's also clear that the financing for NCD is quite low. We are barely at $500 million, which cannot sustain any kind of healthcare system in any country. Yeah, so and like has been said by Joel, there are a number of ways and strategies that the government can get the financing for health care sector, and more specifically for NCD, given that a lot of NCDs and that have been mentioned are caused by tobacco and alcohol. Therefore, we are calling for the government to put more effort towards healthcare financing with a special focus to NCD department, and more so on issues of prevention, because then it is cheaper to prevent. Then secondly, on the issue of policy review, policy development, you want to see inclusion of people who are affected. We want to see people who are persons living with NCD being involved in the process of review of these policies, so that the policies that we are coming up are able to respond to the needs of these particular people. Right now, the Minister of Health is reviewing in the process of reviewing NCD prevention and control policy. Let's see more involvement of persons living with NCDs. Thank you.
Thank you so much, Mr. Ayodo. So next, Mr. Joel Kitali, can you give us your closing remarks?
Thank you so much. I feel my colleagues have said it all. They really talked about the things I would have said. So what I would want to advocate for is that everyone should be responsible, and that the government should be even more responsible when it comes to this, because a healthy citizenry is a wealthy citizenry. There is a lot that we are going to save. There is much that we shall do as a country if we take charge and control these conditions that we are talking about. So it's my prayer that the government talks with one voice. We don't have the Ministry of Industrialization and Trade saying that tobacco and alcohol are essential, and yet the Minister of Health is saying a different thing. Then we want now which is which. And then these flavored products that are intentionally made to attract the children should be removed from the market, so that we save our children from a nicotine pandemic that the world is now facing after the corona. And we must know that nobody should talk about controlling corona or NCDs without controlling tobacco. That one will be a liar. So there should be money allocated for both tobacco and alcohol, which are the senior most culprits of all the culprits that are there when it comes to attacks on our health. And we shall be actually fighting for our universal health coverage to be with us. Otherwise, we shall just be engaging in rhetoric without real meaningful work being done. Thank you so much.
Okay, thank you so much, Chairman. Unfortunately, one of our colleagues, Kiriba, was dropped out, and I don't know how to really go about it to add him back. But just to summarize what we have discussed today, specifically touching on the closing remarks, that we should hold the government accountable to their action, and speak up as tobacco control and alcohol control advocates to ensure that enforcement is actually done. We should also advocate for more efforts from the government towards healthcare financing and prevention, because we all understand that NCDs are quite a burden in the health, not just in the health sector, but basically to our economy, because taxpayers fund the budget funds specific sectors, so it's a burden. Number 3 is actually creating awareness to the community, because we realize that the community lacks information on specific things like the NCDs, the legislations, how to go about it, and even to hold each other accountable. If you see someone smoking, hey, yo, can you switch off that cigarette? You're affecting me. I don't smoke. Do you know the effects of cigarette? If you see someone who's an alcoholic, just take charge and find a way of actually letting them know that it's not just about them, but the society at large. In addition to that, we see that the NCDs have a lot of socioeconomic implications, and that is why we need to speak up in one voice, not just as the tobacco and alcohol control advocates, but even as a society at large. And having said that, I want to thank everyone who has joined this, specifically the panelists, Mr. Ishmael, Mr. Ayodo, Mr. Joy Kitali, Mr. Kiriba, who just dropped out. We are sorry about that. I want to thank you for the very informative conversation, and I want to encourage each one of us, even as we move, as we leave this webinar, we should go on in this discussion online, because we understand the power of advocacy in terms of policy influencing and even making change in the society and influencing behavior change. I also want to thank everyone who has joined our live session on Facebook. Thank you for your comments. I've been reading them here. Thank you so much. They've been very useful in the conversation. Yeah, and I just want to say thank you. Let's go on. The campaign ends in the 20th of September, so let's go on engaging online in these conversations. Let's spike up. I mean, let's make it viral so that people can know that NCDs, it's enough of NCDs, and it's time to make it stop and do something about it. Otherwise, thank you so much, everyone. I want to wish you a good afternoon. No, it's still morning. Anyway, a good day, a good Friday, and enjoy the weekend. Asante sana for joining.
Thank you. Bye.
Thank you.
Bye.
Bye. Thank you, everyone.
Bye.